can have.
So one of the symptoms is headache. Yeah.
You can have dizziness. You can have tachycardia. You can have tachypnea. You can have what again can somebody have? What do we call it?
And mother, in here you should look all most of the major organs. Yeah. Because
no, I didn't get it. I didn't.
so I mean, in here when we write the symptoms, we measure all main organs. Yeah.
Organs that can be affected. So, general weakness.
General weakness.
So what again? There should still be more, but if I remember, we put here. Okay, then. Okay.
Mansour, the first one, it causes headache
Okay.
because blood is going to brain fast. Yeah. And dizziness.
This is the same thing. It's the same reason.
Same.
Because the blood flow in the neural circle are not working.
Mansour, tachycardia because blood is going to the heart fast and make heart fast to pump very fast. Yeah, because of the tachycardia.
Not really. But in this case now there is reduced blood in the body. You understand? Then in that case we are going to also.
Mansour, why blood will be reduced? Blood is coming fast.
Yesterday I showed you, so why did you forget so fast? No, why do we have hypertension? It is not blood is plenty, but blood vessel is constricting.
Constrict now.
If
Yeah.
blood is moving fast, is it easy for now? See, let me give you one example. It is like that, but I'll show you. I'll use this one. Inside there is blood, right? Inside there is blood.
Yeah, blood. Yeah.
Then we say this one is liver.
Liver. Yeah.
Okay. Oh, it's very bad. This one is not good. I can't use it. Come. Let me see if this one will work. You see, this when it is moving fast, you understand, when blood is moving fast, it will not stay. This organ will not be able to take this oxygen in the blood because blood is fast, it is working very fast.
So the
now,
organ cannot take enough blood.
Yes, the blood will not stay in the organ. Now it will be fast, it will be running fast, come to the organ and leave. But if it gets to the organ, it should leave some oxygen, it should leave some food.
So yeah.
But now it is fast, it does not have time to wait and say, okay, let me give oxygen, let me give this, let me give everything. Is just fast.
Like what? Like that you drop.
Yes, but it is if it is different. If now this one comes here and then it stays, if you check with time, it will be coming from here. You understand?
From here, yeah.
Yeah, it is like that. It is different from blood. If there is hypertension, you should expect now even after.
So I mean that the organ doesn't take enough blood, so they make the heart to pump very fast.
Also, yeah, the heart will think that there is no enough blood. And then it wants to give blood to the body.
Then yeah, okay. Master, what is tachypnea? Tachypnea.
It is fast breathing.
Fast breathing. Master, because our organs they don't take they need more oxygen.
Oxygen is reduced in the body.
In the body.
So,
Yeah.
Young ones take more oxygen.
The person takes more oxygen, yeah.
I think why.
Loss of appetite. Appetite means that food, yeah?
You want to eat?
Oh, no, thank you. Loss of appetite. Appetite means that the person doesn't like to eat, yeah? Why?
Loss of interest. No? You are not comfortable. You don't want to eat. Or the person is not concentrated. The person is confused.
General weakness. Why the person became weak?
Loss of oxygen. Deficiency of oxygen.
So it means that will be cyanosis also in the patient.
No, a cyanosis is actually going to happen in a situation by having hypotension if there is no oxygen because there is no blood.
Then it will be cyanosis.
Yeah, in that case we can, because now in that case there is enough blood, right?
Enough.
But without oxygen.
Without oxygen.
It is in this case that we have cyanosis. What is cyanosis? Bluish coloration of the blood vessels.
Blue, yeah.
Because of accumulation of carbon dioxide. But in this case now, oxygen is there, but it is not going to the tissue.
Okay, master, but you told that tachypnea, it means that he breathes fast. Why? To get enough oxygen, yeah? Why there is no oxygen in blood?
I thought I told you before that this blood is moving fast. It's not giving blood oxygen to the tissue.
Yeah.
So there is blood.
So it means that if the organ doesn't take enough blood, it means that it doesn't take oxygen also in the same time.
Of course. It is like that now. Oxygen is in blood.
Yeah.
Blood is not staying in the tissue. Oxygen cannot fly out from this blood.
Correct.
It has to stay, and then it is staying. Oxygen is coming out from it. Carbon dioxide is getting into it. I showed you yesterday something like this.
Yeah.
So oxygen is going out of it, carbon dioxide is coming into it, and some other nutrients like calcium, potassium, they will be taken, leaving from the blood, they will be going into the tissue.
Most why you didn't talk about liver, kidney, and other organ?
When was that?
I mean symptoms for the person, and your kidney also is the main role.
Of course, you can talk about that one, but it is in the situation where you are talking about the complication of it. More likely complication.
It's not symptoms, complication.
It's more likely to talk about the complication. But let us see if we talk about symptoms, because in this, of course, what possible symptoms can we see besides actually there is no visible symptoms if you want to talk about liver in case of hypertension.
Monster, it causes stroke of the brain also, yeah?
And that's why you see dizziness.
Dizziness. But it's also a symptom or complication.
What's that one?
Stroke.
Of course, complications.
Complication.
Yeah, those ones, they are complications. Of course, if stroke is stroke is a big disease on its own. Stroke is a disease that can kill you in less than 1 year. So it is not symptom of another disease. Could be a complication. Stroke, you cannot talk about myocardial infarction as a symptom of coronary artery disease.
It's complication.
So it is like that.
The symptoms.
If we remember the ones we had, and then these are symptoms. It is possible you can still had some of it anyway. And then just something about. I think they are not teaching you about diagnosis now. Maybe I should not be adding diagnosis. They ask about diagnosis.
Mansur, I want to know.
Okay. No, do you think I have problem with it?
No,
I don't.
no.
But I don't want you to think that maybe we are wasting time talking about now. You know you. You just want to know what teacher will ask you.
Yeah. Mansur, this pen. Use this pen, the red one. Diagnose. How to make diagnose the person out of it. Check of the pulse.
So what result can we have? If it is positive, it is called what? If it is negative, it is called what? I think if we check pulse and it is more,
it means that hypertension.
Yeah, it means it is tachycardia.
Tachycardia.
It is when the blood pressure is high that is hypertension. When blood pressure is low, it's hypotension. When pulse pressure is high, it's tachycardia. When pulse pressure is low, it's bradycardia. You understand the
Pulse,
difference?
yeah. And bradycardia.
So we check for the pulse to see if it is. So what is the normal range?
Of the pulse?
Mm-hmm.
Why? 70?
Okay. No, when they say range, it's not one thing. Just as hypertension I showed you.
Yeah, from which time? I don't know.
Mm-hmm. It's okay. So you can have between 60. It should not be less than 60. It should not be more than one thing. You understand?
That's normal.
So we check. Then we check. That is, we check the. And what do we use to check this one?
Which instrument you mean?
What do we use to check? How do we check it here?
I don't know, only by hand. I don't know.
Yes, it is correct. But we use, yes, honestly, it's right. We use to check pulse rates. There are some devices that they use, but it is hand that they use. And how you check it is this. At first, we should remember that if you want to check pulse rates, there are some regions of the body that you follow. Then those regions of the body you can use. I want to just follow this one. You can use
superficial, temporal artery.
Where can we see this one?
Temporal.
Mm-hmm.
Temporal. I don't know. Here.
Yeah, just here.
Here.
Carotid pulse.
Carotid artery. Radial.
Yeah. So we check carotid pulse here. Check radial pulse. We check axillary artery, but the major ones I'm just trying to bring out now. Radial. We can also check femoral artery. So these are some common places where we check the pulse rate. You understand? And then you can check for this one now. This is how you check it here. You
So
put your
which
hands
one?
here.
So
This
which
one
one?
is radial. This one is radial.
Radial artery.
Okay, please do it. You see. Can you feel anything?
I feel of her.
All right. So what you have just touched now, it is radial pulse.
Radial pulse.
So and that's when it is supposed to be between, if it is 70, 72 and 90, like that, it is
From 70 to 90 is normal.
Yeah, if it is 60, all these ones they are normal. If it is less than 60, it is not bradycardia.
That's for all?
It's for all.
Master, where is carotid artery?
Major artery that supplies blood to the brain. We talked about this yesterday, right?
I know, but where is, I want to see.
Okay. Then if you want to see,
Yeah.
you're going to, it's I cannot see your hair here. This is
So can you put my finger there?
yeah, I want to check the body of your what they call this muscle, sternocleidomastoid muscle, right? Sternocleidomastoid muscle. So shortly behind sternocleidomastoid muscle, we are supposed to see carotid artery. Okay, I think your phone can show it. Maybe your phone will not see it later. Okay, so here probably you're going to see it later with when you are watching the video, but it is here, so you can check it.
Just
yeah, you check it here. You're supposed to feel the pulse.
I don't feel.
Wait.
You feel?
Not yet.
I don't have it.
Yeah, because everybody has. Okay, I think it's around here. Maybe I missed your sternocleidomastoid muscle. They use Okay, you can try it in this region. You ask the patient to move.
Mansur, what about for you is yes, where?
Let me check. Let me trace it. When I find it, I just bring your hand. Okay, please. You can bring your hand here.
Yeah,
Okay.
I see. I see. Okay, this is carotid artery. Radial artery you showed. Femoral artery is here.
Yeah, but in the medial side. Yeah.
Okay. That's for diagnosis. But Mansur, for example, we don't have any instrument instead of the hand.
Which is what they okay. Which instrument would you put in the neck of somebody? What they do is there are some like sphygmomanometer of you that you collected that time. What we used to check blood pressure.
Ah,
Okay, that one now they make some of them that if it is checking blood pressure, it is also recording pulse rates.
it will
Now,
tell you both.
yeah, so if you can buy this one, it will show blood pressure is this, pulse rate is this. So it is like and it's like that.
Mansur, what is pulse rate? What's pulse rate? To know tachycardia and bradycardia.
Okay. Yeah, and
So if it is between 60 and 90, it is if it is more than 100, it means that the person have tachycardia. If less than 60, it is bradycardia. To tell the person, but it cannot tell you blood pressure. Yeah, it's not for blood pressure. Yeah.
yeah. How do you check blood pressure?
How do you check blood pressure? By this. By brachial artery, the one we put.
This one is beats per minute. How many times it beats in 1 minute? Blood pressure is how fast it moves.
Beating.
You cannot relate it to your blood pressure. Okay. Another thing that we are going to check pulse rate is like one. B it is check pulse rate. Want to diagnose for hypertension. Then blood pressure check. Check blood pressure. So we already know what our blood pressure is, right?
Yeah.
So diagnosis. So this one we can see if it is tachycardia, it is hypertension. It is likely to be hypertension. Check for blood pressure, and then let me see other things. So we can also check for partial pressure.
Partial pressure
Of oxygen, just written like this.
PO2.
The PO2. I think this PCO2 or something like that. Something like this, yeah. Boy, I think here they put W here. As in, it's not like this. Partial pressure of oxygen, then check for partial pressure of carbon dioxide. You understand?
So, Mansur, what is normal for auto partial pressure for oxygen?
Actually, this one you check it by you check this one by what they call it, the acidosis, metabolic acidosis, respiratory acidosis, and then it's supposed to be between 7.35 to 7.45, and then the ratio is not going to be what I think it's 7.35. So this thing is actually, you use this pH to check for it. 7.35, it's supposed to be between this one. So if it is less than this one, you will call it acidosis, and if it is more than this one, we call it alkalosis.
Alkalosis.
So, and why they need to know the pressure of this one is to know if if the oxygen content in the blood is normal or not. So another thing that we can also check is, I think, blood test to check for anemia. Okay, another way we can diagnose hypertension, blood volume. Okay.